Good afternoon and welcome to this edition of H360 Live. My name is Dave Duplay and joined here in the studio with me is my colleague Cortland Long from Healthio360. Hi Cortland.
Hi Dave, how are you?
I'm doing great. What about that interview last night with our friend Anthony?
It was phenomenal.
Yeah, really a great guy. He was a guy, in case you missed it, that is in need of a bone marrow transplant. If you missed that, you can watch it on demand at Healthio360.com. We have an equally exciting show for you today. We have Jim Donachie going to join us here on set in about 5 minutes. And Jim is going to talk to us about this new innovative technology in telemedicine. You're not going to want to miss this. But first, as always, we have a very interesting article for you, one that we read this week. And the article was entitled Your Body's Witching Hour. And it had all the things to do about circadian rhythm. Now, Cortland, we've all been there. We've all pulled the all-nighters. We've burned the proverbial midnight oil, whether we're a student studying for an exam or whether our boss comes in and puts something on our plate at the last minute and we want to do a good job, so we stay up all night. Well, did you know that staying up all night, and there are other things that we're going to share with our viewers, but staying up all night is one of those things that is really detrimental to your health. And it's not only that you're going to be tired the next day, of course that's going to happen, but there are some other things that happen to your body when you throw off your circadian rhythm. So Cortland, it was a very interesting article. I'm just dying to share it with our viewers. Can you tell us about the circadian rhythm and what happens when certain things like staying up all night occurs?
Yeah, your circadian rhythm is very important to your health. It's a cycle that overturns about every 24 hours, and it actually drives nearly every system in the human body, from circulation, cognition, metabolism, memory, and even mood. Now, small things and even large life events can disrupt your circadian rhythm, such as traveling, erratic work schedules, or even watching television or staying on the internet late into the night. Even that small 1 hour shift in the spring when we change our clocks forward, that raises the risk of heart attack for up to a week.
Really? Even changing the clocks back and forth from daylight savings time has that kind of impact. It would seem to me like we would see people dropping left and right with this circadian rhythm throw-off. Is there more?
There is more. So these simple disruptions, they raise the risk of a variety of health problems, such as heart disease and diabetes. Now, keeping our biological systems in sync with light and darkness plays a really important role, and sleep is very important for that. Now, some people are at a greater risk for some of these health problems. Those who work late night shifts are more vulnerable to when they eat, sleep, or even work out of sync. Now, they're at higher rates for heart disease, diabetes, obesity, high blood pressure, and even stroke. The elderly as well are at a greater risk because their sleep cycles are more fragmented, they're earlier and shorter, so they can be at an increased risk for cognitive impairment, mortality, depression, and this is even increased in populations with Alzheimer's.
Cortland, I have to ask, do you think the circadian rhythm is different from, let's say, somebody living in New York to somebody living in maybe Arkansas somewhere?
Well, I think the circadian rhythm is, dependent on every individual person. And I think people living in New York, where we get a lot of light pollution, so, your room maybe isn't quite so dark when you're trying to sleep at night, probably affects your circadian rhythm rather than if you're living in a rural area, you get complete darkness.
Yeah, very interesting article. Yeah.
Now, there are some health events that are more likely to occur at specific times. Heart attacks are more likely in the morning. Epileptic seizures can peak in the late afternoons, and asthma attacks can be worse and even more deadly between the hours of 11 p.m. and 3 a.m. The study of circadian rhythms, known as chronotherapy, is really a new field in medicine, and doctors are starting to tailor treatment strategies with light therapy and determining what time of day your medication will be more beneficial to you.
So it seems like there are a lot of triggers, right, that's going to get your cycle off. And there's a lot of things that happen at certain points of the day that people should be aware of.
Yes, there are.
Yeah. Well, we sent our interns out on the streets of New York because we wanted to see if people really knew about these triggers and about what happens at certain times of the day. Would you like to see?
I'm really excited to see what the city that never sleeps has to say about circadian rhythms.
Okay, let's roll the tape.
What time of day do you think would be worse for your overall health?
Probably like the afternoon is the worst for me.
8 o'clock in the morning when I have to get up to go to work. Yeah.
The early morning is worse for your overall health.
I think in the late afternoon is where people kind of have a little lull in how they feel.
And what time of day would you say your blood pressure, heart rate, and body temperature is at its lowest?
I would say at night because you're just resting and not moving at all.
Late night. Whatever you did in the day is done and it's behind you, and it's a good time to relax.
11 o'clock.
11 o'clock in the morning.
A.m. I would think in the morning.
Probably right when you woke up because you were just sleeping.
What time of day do you think your blood pressure is the highest?
I would say like maybe the early morning or like mid-afternoon around like 1 or 2.
Probably about 3 o'clock. And I would guess the late afternoons.
I think that probably depends on like your job and like what you do with your time, because your heart rate could probably be higher if you're like a personal trainer versus if you like work at a computer all day. So I think it depends on your job and like the stress level you have.
What time of day do you think heart attacks occur the most at?
Ooh, heart attack.
I guess it can occur any time. It doesn't really matter.
Probably about 3 o'clock.
3 p.m., I don't know.
I am told that for people who are on heart medication, they occur in the early morning before you've had a chance to take your meds and for it to, do its work.
Wow, Cortland, that was really interesting. And I have to ask you, I guess a Mr. Softy ice cream cone in the summertime is one way a New Yorker would cool off.
I suppose so.
Yeah, he was very opinionated also.
He was. They had some great reactions to the questions.
Yeah, and how about the lady that really was pegging the time frames?
She was very specific with that 3 p.m. answer.
That 3 p.m. answer. Yeah, you got to love that. Well, I guess New Yorkers are pretty informed,
I think they are.
or at least they have an opinion.
Yes, they do.
Very good. Well, look, now is my favorite time of the show. We're going to be bringing our guest in just a second, Jim Donachie. But before we do, I want to go through some statistics about this telemedicine business because it's much larger than I thought, and I'm sure you're going to agree with me. But did you realize that 89% of healthcare executives expect telemedicine to transform the U.S. healthcare system? Well, that's a lot of opinions from a lot of executives, and the global telemedicine market is expected to grow to get this $27.3 billion next year in 2016. The number of patients using telemedicine services will grow to 7 million by 2018. That's a lot of patients using it. Telemedicine could potentially deliver more than $6 billion in cost savings, taking money out of our healthcare system. And the percentage of healthcare employers offering telemedicine services is expected to increase by 68% next year. That tells me that employers are seeing the value of having their employees participate in telemedicine. Jim, it's so good to have you in the studio today.
Thanks, Dave. Appreciate it.
I understand you are a Marine Corps veteran.
Yes, that's correct.
My brother is a Marine Corps veteran,
Hoorah.
and so I just want to say to all the young men and women out there serving in our armed forces, we really appreciate everything that you do in keeping us safe. Jim, this telemedicine, very interesting, big numbers. It's growing.
Yeah.
What I like about it is it's taking cost out of healthcare, which is a good thing. It's convenient. So let's start with, kind of talking about Ally Health.
Yeah, Jim, Ally Health has a number of different services from telemedicine, prescription discount, vision, and dental.
Sure.
But can you give us a high level of all those services, and then we can really drill down into what telemedicine is?
Absolutely. So Ally Health in and of itself is, you want to think of it like a sort of a three-pronged approach. You've got medical bill negotiation, the telemedicine or doctors by phone / video, depending on how you wanted to look at it. And then, of course, there's a host of other healthcare-related discount type of platforms. Okay, and they're all basically like platforms. So with medical bill negotiation, it's pretty simple. You've ever been to the hospital and you've gotten a bill 2 or 3 months later, you figure my insurance has it, they're taking care of it, and suddenly the bill shows up and you've got this huge, a death, and you're looking at it and saying, I don't understand what this is. I don't know what these codes are. I don't understand that. Simply send them into us. We'll take a look at them, explain it all to you, figure out what's fair, what's not fair, identify maybe overcharges, things that maybe should be possibly covered by insurance, and so on and so forth. The telemedicine and doctors by phone, by far my favorite. I use the service myself on a regular basis. We actually are partnered with MD Live, and through our platform, consumers can actually save themselves a tremendous amount of money by becoming a member and having unlimited access to a doctor 24/7, 365, board-certified physician. Okay, whether it's on the phone or on their iPhone or Android phone, or even on their laptops or home computers. Basically, giving the ability for people to access to board-certified physicians and really quality health care from the comfort of their own home. And then, of course, there is another network that handles the healthcare-related discounts specifically, and probably the largest would be the pharmacy discount card.
Yeah,
okay.
We're familiar with that, of course, because we're partnered.
Exactly.
Yeah.
Exactly. Very large network, saving consumers up to 85% on their prescription medications. This part of Ally Health is really kind of designed for those who are paying a lot of their healthcare costs out of pocket.
Yeah.
Even at that, if you've got high deductibles, high copays, and so on and so forth, there are plenty of ways, for this arm of Ally Health to help you out. Specifically, the prescription discount card is completely free. It requires no registration. Think of it like a coupon that doesn't expire.
Yeah.
Okay, you can use it over and over and over again. And even if you have a high copay and you're covered by insurance, or even if your copay is somewhere $10, $15, always check our price, because there's plenty of times where our price is less than a $10 copay. And people just don't realize it because they're saying, hey, I have insurance. Insurance is going to take care of me. Thank you, insurance company.
Yeah.
And here we are. We're giving them, an opportunity to save another $5, sometimes $8 on their medication that they didn't know they could have saved. Yeah.
Right.
And then, of course, the medical, the vision, and dental, all very, very strong networks with significant discounts for very, very small fee on a monthly basis.
So, as Cortland said, we want to take a dive a little bit into MD Live, because this really fascinates me. And so there's so many questions, but can you give us a little flavor for the typical process one would go through in using MD Live?
So using MD Live is so simple, and there's so many different ways that you can do it. Traditionally, the term telemedicine, this is sort of how it all started. You would speak to a doctor by phone. But technology has allowed us to go ahead and talk to doctors video, okay? And you can do video even from your phones now, because there's actually an MD Live app. So the way that it looks is this. When a patient becomes a member of MD Live, they are given a portal. They can access their portal. They can actually search doctors within their area or within a certain field that they're looking for. Select the doctors that they want to speak to, okay? Based on their bio, as well as they're actually, I think, going to be doing ratings, like WebMD ratings and things like that. Mm-hmm. So that is really, really unique in this industry, because I don't think anybody does that. You actually have the ability to speak to your doctor. You'll have the ability to know when the doctor's available and make an appointment or speak to somebody now. So the traditional sense, I'm sorry I kind of got off on a tangent there, but in the traditional sense, a member would call 800 number. They would speak to a care coordinator. They would designate, okay, yes, you definitely need to speak to a doctor. You would hang up the phone, and then boom, within 9 minutes, you're getting a call back from a doctor. You're having a conversation with the doctor, and you're describing your symptoms and so on and so forth over the phone to the doctor. And the doctor, who is very well trained, board certified, very well trained in telephone protocol, how to do diagnosis over the phone. Pretty simple, maybe 20, 30-minute conversation. And at the end, if there is a prescription that might be needed, the doctor has the capability to call in the prescription for you, and you haven't left the comfort of your home.
That's interesting, 20 or 30 minutes. When I see my doctor in the office, I'm lucky if I get 5 minutes, quite frankly. So that's.
But how long are you waiting before you go in there?
Well, yeah, I'm waiting quite a while.
Exactly.
Unfortunately, it always seems like it's on a par with the DMV in some cases. However, but I know Cortland has some thoughts.
Yeah, so When does a patient choose to speak with MD Live rather than going to see their primary care physician?
Okay, that's a great question. With telemedicine or with MD Live, you're looking at most of the common things: cold and flu, allergies. You're having a respiratory problem, joint pain, arthritis type pain, stomach sickness, constipation, things like that. There's just a host of common reasons why. Now, of course, if you're having something that would be considered an emergency, an MD Live doctor is going to tell you to go to the emergency room. They're not going to, if you're bleeding or whatever that might be, or feel like you might be having a heart attack or something. Certainly you want to go straight to the emergency room. But in the middle of the night, or later in the evening, and you might be having a chest cold or just really be bothered by flu symptoms. It's not necessarily a reason to make that run to the emergency room, pay all that money, spend all that time when you can actually pick up the phone or pick up your smartphone or Android phone, speak to a doctor and get a prescription, and off you go.
Yeah.
I wish this service was around when I was in college. I used to get tons of strep throat infections. The doctor would always be like, well, you have to come in, I have to see you. So knowing now that you can communicate with a doctor over your phone and get your prescription called in, that's awesome.
That's a great point, especially like with college kids, if you're traveling. I mean, there's so many ways to apply.
Yeah. So what is the cost of using MD Live? I know with a lot of insurance companies you have a copay or a threshold to meet.
Well, the good part about MD Live is the cost. That's actually one of the best parts about it. For an individual, $16.95 a month, unlimited uses. So that means you can call the doctor 4, 5, 6 times. Now imagine what that would cost you if you were paying your regular copay to your doctor.
Wait, can you say that one more time? Am I hearing right?
$16.95 for an individual per month.
Unlimited.
Unlimited access to the doctors, yes.
You talk about cost savings.
Yeah, it's huge.
Yeah, huge.
I know my copay for my doctor is $40 just to walk in the door.
Yeah.
And it takes me about 4 hours out of my day because I have to make the appointment, get to the appointment, wait to see the doctor. Right. Get in there for, just like you said, for the 5 minutes.
Right.
And I come out and it's $40 when I could have really just had a conversation with the doctor for my smartphone to get some antibiotics.
Yeah.
Right. So earlier you mentioned a couple ailments. What are the most commonly treated conditions with MD Live?
Well, the good part is a few of the things that I mentioned, would be more kind of the adult side. There's even a pediatrical side as well, with children with constipation, ear infection, swimmer's ear, pink eye. But I would say some of the most common would be the cold and flu symptoms, things that needs, maybe a Z-Pack or something like that. That would probably be the number one reason why people would use it, because it just saves so much time. And so much money from having to go to the doctor for something that really is just a basic antibiotic.
Wow.
Yeah, definitely. And earlier also you'd said, when you call in, you speak with a care coordinator and they route your call. Is that every time that you call in?
That's every time you call in, yep.
Okay.
Well, so...
Provided you're using the phone, of course. If you're doing video, it's a little bit different.
Yeah. So, Jim, I have to ask, and I know our viewers are wondering, this is the internet. And almost on a daily basis, I pick up the paper and I'm reading about a data security breach, whether it happens to be Target and credit card information or a bank. Tell me about the security. My health records are very, number one, important, but two, very private, as everyone should be. And there's this thing called HIPAA, right, which is confidentiality and privacy.
Absolutely.
Tell me how your system works and how do you handle data, and how are you going to ensure to myself and our viewers that their data is kept safe?
Well, I can tell you what I do know, that as you heard me mention, the doctors are trained in several levels of protocol as it pertains to either video or telephone diagnosis. The conversations that happen or the interactions that happen are digitally archived in the highest level of security. The only people that actually have access to that conversation or that interaction is you, the patient, and the practitioner, and that's it. Okay, so it's essentially, it goes on in a lockdown vault at the highest level of security, 100% HIPAA compliant.
So this care coordinator that you speak of, that person does not have access to that medical record?
Now, all that person is doing is making the connection to you and the doctor.
I see. So with this growing technology, how many current users do you have on MD Live?
MD Live is, I believe, right at or just above 3 million people that are members of the MD Live platform.
Wow. So that's, and growing, I
And
assume.
growing every day.
When we look at the numbers and we talked about the statistics, the industry is just growing. And again, the thing that I like about it, quite frankly, is it's not only saving time and money, it's taking cost out of the healthcare system, which we know is very important. Tell me about, so the security is there,
Security's
right?
there.
The members are growing. Ally Health has so many arms. So if I sign up for MD Live and I pay the $16.95 a month for unlimited, what are some of the other benefits that I can leverage? Do I also get access to some of the other things that you mentioned early on?
You absolutely do, yeah. The medical bill negotiation that we talked about, that actually, once you become a member with us through Ally Health, that actually becomes part of your membership, along with, of course, the access to the prescription discount platform. So all that is included in the price, and it's a pretty amazing savings when you think about what you're looking at for the cost of a copay, just on a monthly basis, for even if you only talk to the doctor one time a month. The cost savings for the prescriptions alone, up to 85%. They've actually gone higher, but try to keep it real because it doesn't happen very often, but we've gone up into the 90s. Huge savings at no cost to you. And then, of course, the medical bill negotiation. I can recall when my daughter was born, I got bills from every direction, and I didn't know what was what, and I was writing checks just to make sure nobody was on my back, and the bills just kept coming. I wish I had something like this to help me out. Say, hey, is this right? Should I be paying this? What is this too high? Is this an overcharge? Something like that. So all that included, and for $16.95 a month, that's a pretty sweet little deal right there.
Yeah, I want to go back just a minute and talk about this prescription discount card because, as our viewers know, that it's on free on Healthy O360. If you go to our perks section, there's a number of ways you can get the card. One is you can print it. The second is if you want to put your mobile number in, we'll text you the card. So it's very easy. You take your smartphone to your pharmacist, you show them the text. It's got all the appropriate numbers for the discount. I want to remind everybody this is not insurance. It's supplemental to insurance. But Jim, I'm asked all the time when I hand the cards out, well, you're going to save me 85% potentially. It's good at over 90% of the retail pharmacies, the big chains as well as many of the independent pharmacies. Who pays for that?
It's pretty interesting. I get asked the same question. I hear the too good to be true scenario.
Right.
It's pretty simple. The discounts are negotiated directly with the pharmacies. Okay. Whenever somebody actually takes one of your cards, uses it and experiences a savings, pharmacy pays a very small fee. Okay, and that's just it. All right, the pharmacy pays out a very small fee, and that's sort of to support the program. But the pharmacies are the ones that are accepting the negotiated rates for a couple of reasons. One, for adherence reasons for their clientele. Two, to gain new foot traffic, of course, because we're marketing to them. And then three, if they're not accepting it, their competition's going to accept it. So, that's kind of keeping up with the Joneses, if you will. But ultimately, in the end, it's not a matter of so much who's paying for it. It's who's not overcharging for it. That's kind of the way I look at it. It seems a little harsh to say that, but I mean, if you look at some of the discounts on some of these medications that are available, $500 medications for $75, it just shows you some of these prices are just out of whack, especially in the generic space.
Yeah. So, again, back to the card, I know that a lot of our members and viewers out there are living with diabetes. And I get so many emails, I get so many calls from people saying, is there help for my test strips and my other supplies that I need as I'm living with my diabetes? And does the card cover that?
For diabetes medications, yes, anything that would be a prescribed medication, anything that has a prescription or an NDC, yeah, we would offer a discount on some of the hard supplies or the actual the diabetic supplies. I don't know that we have full coverage on that, but I know if you look at how Ally Health works, we're constantly expanding and looking for new partners. So understanding that that's a huge segment. We are certainly looking into going for more of the supply side of it as opposed to to go along with the medical side of it.
Yeah. Well, again, this prescription discount card is free. There's no obligation on your part. You do not have to join the MD Live and pay the $16.95 a month to get the free prescription discount card, which is found at healthyo360.com. Well, Jim, thanks for coming into the studio today. Unfortunately, that's all we have time for. So I'd like to thank you for making the trip from Philadelphia. I'd like to thank the viewers and members at home who are watching our show on a weekly basis. And I'd like to thank, of course, our sponsors for making it all possible. Remember, all of our episodes can be found on demand at healthyo360.com. Our podcast can be found in the iTunes Store. Remember, Healthyo can be found on Facebook, Instagram, Twitter, and Pinterest. Please don't forget to use the hashtag #RealStories when posting. So on behalf of myself, Cortland Long, and the entire Healthyo360 family, I wish you a very pleasant afternoon, and I look forward to seeing you again next week.
The views and opinions expressed in this broadcast are those solely of the Healthyo360 hosts and our guests for this broadcast. These views and opinions do not in any way reflect the views and opinions of our sponsors, advertisers, or other organizations on Healthyo360, including our community members.